Sequim Free Clinic is my favorite nonprofit in our community. It's really a safety net clinic that is really needed, providing basic urgent care, chronic disease management clinic, and wellness education. Because we all know prevention and taking care of ourselves, staying well, is the best way to control healthcare costs.
Back when I moved here in 2017, I could not find a PCP that would see me up from 6 to 9 months away. And a friend referred me to the clinic here. And they saw me right away. They refilled my meds. They were just compassionate and very welcoming to me.
We do surveys every quarter, and the most common thing from the patients is, "Thank you for treating me with respect and giving me time to talk."
Hello, good evening. I'm Dr. Carl.
The beauty of having volunteers is many of them bring 30 or 40 years of personal experience to the role. So they are very comfortable here, and they bring their medical skills, their people skills, their empathy, their compassion, and their willingness to serve. And it's really why they're here. They want to give back to the community.
One of the most positive things about our clinic here is that it's available in the evenings, and we have a very low barrier for whether you've got insurance or not. We don't really ask. Some people are in between doctors. Some people can't find an appointment or can't get in quick enough, so we can fill the gap there. The biggest thing is that we're here for them, and there's no barrier.
I've been coming here for about 5 years, and I came in originally just because I had moved here in 2019 and I had run out of blood pressure medication, and I needed somebody to write me a prescription, and they were like, "Well, you're here, we'll just do some blood work on you real quick." And it turned out, when the blood work came back, that I was severely anemic. I was able to go and get some iron supplements at the supplement store, and went back 3 months later, and they pulled more blood work, and things had dramatically improved.
Over the last 25 years, the Sequim Free Clinic has provided about $7 million of clinical services for our community for about 1,200 patients a year. And the actual cost is about $3.4 million. And the difference is volunteers and donated services. We can take a dollar that's donated and stretch it to help more patients in our community.
I had no insurance. They saw me, and I have stayed since 2017 because they're caring. I feel safe here. I feel well taken care of.
The Sequim Free Clinic is successful for really 4 reasons. The first reason is our volunteers. We have volunteer physicians, advanced practice clinicians, RNs, and many skilled professionals and dedicated workers. The second thing is we have donors that support the free clinic. We have to pay for electricity, for insurance, for our part-time staff. And third, we have a lot of community partners. The glue and the magic of the Sequim Free Clinic is really our part-time employees. We have 5 dedicated professionals who are here for the mission.
I kind of feel like I shouldn't have to take advantage of the free clinic with, the work that I do and stuff, but I did not have health insurance at the time, and I just could not afford to go see, a doctor without insurance.
If you think about a person who's sick, needs health care, has no access, has no financial resources, that's a very lonely and scary feeling. And the clinic provides much needed care. It gives people hope. It makes a huge difference in our community.
I really have to thank everybody who volunteers here, who donates. I know that you don't have something like this everywhere, and they put a lot of time and effort and heart into it.
We wouldn't exist without the volunteers. All of their energy, their knowledge, their compassion, that comes through all the time. Without the volunteers, we just wouldn't have an organization at all, including our volunteer board.
I'd like to say thank you to the donors, because the donors make a huge positive difference in our community. Without our donors, none of this would be possible. No money, no mission. It does cost money, insurance, electricity, our part-time staff, and you really make a difference. So thank you for helping us achieve our mission.